The surgery and your hospital stay. The morning of your surgery at 5:30 a.m., you will arrive at the 75 Francis Street entrance. You can leave your car with valet parking, which is for patients' use only. At this entrance, the valet is available 24/7. Go straight through the doors, walk past the information desk, and you will see signs and the entrance to the hospital's general admissions office on the right. Here, the receptionist will greet you and check you in. Then you will be escorted to the preoperative area where you will change into a hospital gown. In pre-op, you will meet your nurse and your anesthesiologist, as well as other members of the anesthesia and surgical teams. If not previously signed, you will be asked to review and then sign the consent form. From pre-op, you will be wheeled on a stretcher to the operating room and transferred to a surgical bed. Looking around, you will notice several monitors. If your surgery is going to be done with the assistance of a robotic system, you will see the device over in the corner ready for use. For many years, thoracic surgery was performed by making a large incision on the side of the body and then spreading apart the ribs to access the chest cavity. In recent years, technology has enabled surgeons to perform what is called minimally invasive surgery. A telescope attached with a tiny video camera is inserted into your chest through a small incision. Looking at the monitors, your surgeon can see inside your body and complete the surgery without the need to open up the chest. Minimally invasive surgeries have many benefits. Since they have significantly less impact on your body and smaller incisions, you will have less pain, less risk of complications, and spend less time recovering. Even if your particular surgery requires a large incision, these techniques have allowed the incisions to become smaller and smaller over the past 30 years. The anesthesiologist will place a mask over your mouth and nose to deliver the anesthesia, which will put you to sleep for the length of your surgery. You will not be aware of events or feel pain during the surgery. Next, a tube is inserted into your airway. The tube is then connected to a ventilator, a machine that pushes air into the lungs to assist you with your breathing. You will be positioned, draped, and the surgical area sterilized. Then your surgeon will make a number of small incisions for the camera and the surgical tools. In order to remove the lobe, it has to first be separated from the attached bronchus, artery, and vein. Then the lobe is separated from the remaining lung and removed. This is done with a small surgical stapler that seals and divides tissue. The surgeon will also remove any nearby lymph nodes as a precaution against the spread of the disease or cancer. When all the attached tissue is removed, the surgical incisions are sutured, closed, and bandaged. A tube is inserted into your chest. It is needed to drain the excess fluid and air during the first few hours of your recovery. With the lobectomy complete, you will be transported to the recovery room. When you wake up, you will be in the recovery room. Here you will be greeted by the recovery nurse who has been observing you and monitoring your vital signs. You will notice several things. You will be connected to an electrocardiogram, or better known as an EKG, which tracks your heart rate and breathing. You will also have a tube in your chest that is draining excess air or fluid from your surgical area. You will have a Foley catheter, which is a small tube that is inserted into the bladder to drain urine. You will have an IV in your arm, which is inserted into your vein to deliver fluids and medicine. Medical staff will be close by not only to monitor all the equipment, but also to try to make your time in the recovery room as comfortable as possible. You can expect to be here anywhere from 2 to 4 hours. We know you are ready to go to your hospital room when you can sit up on the side of the bed with your feet dangling down and not get dizzy. The nurse will equip you with a telemetry box, which is a portable heart rhythm monitor. Wires that are attached to your chest now will go into a battery pack that is located in your gown. Your heart rate and rhythm will be continuously monitored. You will use a thoracic walker while you are recovering in the hospital. This is a device that helps you start walking as soon as possible, which is beneficial for quicker recovery. The thoracic walker is also designed to carry everything you might need, such as an oxygen tank, chest tube vacuum, IV pole, catheters, and monitors. Initially, you will be given only liquids, but will soon be given solid food. The three main goals as you recover in the hospital are to quickly get you mobile, eating regular meals, and back home where you can rest comfortably. You will likely have trained physical and occupational therapists helping assess your progress toward regaining your function. In the next day or two, once your lungs begin to heal and air and fluids stop collecting, your chest tube will be removed. One of our medical staff will take off your dressings and cut the sutures that hold the chest tube in place. Before they remove the tube, they will ask you to take a deep breath in and hum. Once the tube is removed, they will use sutures to close the opening and apply a clean dressing. Then you will be told to rest for about 20 minutes. Removing the chest tube is quick and doesn't require anesthesia. Expect your stay in the hospital to be between 1 to 5 days. In order for you to go home, we will look at your BRAT score, which is a clinical assessment tool that helps determine your readiness to leave the hospital and continue recovery. You will be asked to walk around the central core of the thoracic wing 6 times without oxygen. If you can maintain your oxygen levels, then you are ready to leave the hospital. You may be discharged with a taped dressing. One type used is Tegaderm, a transparent film dressing that covers the site where the chest tube was removed. Your care team will provide instruction as to how long this dressing should remain in place. Under the dressing are the sutures that will be removed when you come back for your first office visit after surgery. Please be aware that when you leave, you will be required to be escorted in a wheelchair to the front entrance. Since you cannot drive, you will need a person who can be flexible and ready to pick you up when you are discharged. If you are discharged on a weekday, before you leave the hospital, one of our staff members will set up a follow-up appointment. Patients discharged on the weekend are given a phone number and asked to call the office on Monday. Follow-up visit is very important. Not only will your chest tube sutures be removed, but your doctor will have received the full pathology report and will review it in detail with you. Many patients like to have family members or a close friend present, and you are welcome to bring someone to this visit if you think it would be helpful and comforting.